welcome everyone to this latest webinar on the What to Look For When Acquiring series. We've got Robert Graham and myself, Tony Capert here, and this session we're going to be talking all about the home care space. So what to look for when acquiring a home care provider. Robert, who I'll introduce in a second, he's got a ton of experience, has purchased several companies. We're just chatting earlier, currently under contract to purchase 2 more and is doing a roll-up. So he is the man when it comes to this world. And like always, we're going to dig into the specifics of this industry, how he got into it, what he looks for in a company, what good versus great looks like, et cetera. So it should be a really, really good session, and I'm really looking forward to it. Just by way of introduction, let me give you the quick minute on myself, and Robert, I'll flip it over to you. Again, my name's Tony. My background's primarily in software. So I built a venture-backed SaaS business, sold that a few years ago. And once I did that, built a small vacation rental fund and a sister property management company. So I got started in sort of the more of the sort of sweaty startup nitty gritty business world in sort of property management. But I got really excited by that world and started looking at other businesses that were similar to invest in. Sounds a lot like search. And so since then, I've been investing in self-funded search deals, put together a small fund to do that. And we're doing about 10 deals a year at this point. So for folks who are doing a self-funded search, we are very active investors and writing about 100K checks into deals all the time. And home care is one of the spaces we're interested in. So if you want to chat, feel free to reach out. Would love to talk more. But Robert, why don't I flip it over to you? Would love to give a couple minutes in your background, and then we'll dig into your world.
Thank you, Tony. Appreciate you having me today, and appreciate the great introduction. I love the title, "The Man in Home Care." That's very complimentary. Thank you.
Exactly. Well, I think of you that way. Like when there's one person who like knows the space, like it's you.
Well, thank you. I appreciate that. Hopefully I don't disappoint you today. So anyway, I did a self-funded search it started in 2018 with a partner. And we started looking mostly in the home care, home health, hospice space, and also PT, OTST. And we searched for about a year, ended up finding a group of home health, home care, and hospice companies in the Dallas-Fort Worth area that we acquired using an SBA loan. We had bought that business at the end of 2019. Since buying that business, we have taken the home health census from 75 to 230. We took the hospice census from 5 to 18. And the home care census we took from 280 to 310. So
those numbers you're talking about, by the way, are those revenue numbers, or what are those?
Oh, I'm sorry, Tony. I should have clarified that. That's census numbers, patient census numbers.
Patients. Okay, got it.
So that's probably our most. That's the operational metric we place the most focus on a day-to-day basis, driving that census, because census is an operational metric. Obviously, that is very closely tied with financial metrics that at the end of the day are what our investors care about. But we're always looking at those operational metrics. Anyway, so Pillar Health Group is the acquirer of those 3 companies. Since doing that, have also started a separate group called Search Investment Group. And the purpose of Search Investment Group is more like an advisory firm. And what we do is we advise searchers on finding the right company, getting through due diligence and closing on it. And then we help them raise capital from a group of investors that we're very close with that, is willing to invest on very attractive terms for the searchers. So we've helped several searchers close deals on great terms. Here more recently, we helped a guy buy an institutional pharmacy. He ended up being able to keep close to 80% of the common equity of the business. 1.5 million of EBITDA, institutional pharmacy. It was a great deal. But we've had several deals like that. And in addition to that, I'm currently helping a searcher acquire a large home care company in the Midwest through Search Investment Group. So that's kind of neat because that company will actually be folded into Pillar Health Group, but it's a searcher who I'm working with through Search Investment Group. So lots of opportunities to work together, but excited to talk to the group today. And thanks for the intro, Tony.
Yeah, no, I think what's compelling about your background, Robert, is obviously this home care and to some extension home health space really well, but you also are looking at a lot of other types of investing in sort of search investment across the board. So I think it's a nice marriage
That's
of the
right.
two worlds that I'm also in. Anyway, but before we dig too much, I'm like so tempted to just dig right into like asking some questions, but just want to do a couple two housekeeping things. One, this is a webinar series. We've done a few already, and digging in with the light manufacturing world and HVAC. Those were really great sessions with Sam and Nicholas, and obviously we're talking home care today, but we're going to be doing several more throughout the summer, likely into the fall. If you're interested in getting invited to these, just shoot an email to webinars@bluemaple.co. And then secondly, I should mention everyone's muted just because the group's too big in this webinar. But if you do have questions, please use the chat and throw them in there. Happy to, this is going to be pretty conversational with Robert and I. And so should you have questions, you want us to dig into an area in particular as we're going through, please send those in and I'll be sort of directing us as well as I can. So without further ado, this is what we're going to cover, why this industry, good versus great, big risks, where to spend time during diligence, and then biggest lessons learned. So Robert, you started talking a little bit about some of the deals you have done. Can you just give us like the high level take of the acquisitions you've done so far, and maybe just in the interest of time, we can focus on the one or two, and we can go from there. And you give the quick overview.
Absolutely. Thank you, Tony. Yeah, so the first deal we did was in late 2019. We acquired 3 providers of home care, home health, and hospice, which I'll get into later with the difference between those. But we paid just south of 4 times for the business, used an SBA loan to do it. And then currently we have 2 deals ongoing. So we have one provider in the Southwest. They do intellectual and developmental disabilities. That business is a fantastic purchase price. It's right around 3 times for a 3.2 million EBITDA business. And then we also have one, a searcher that I'm working with is acquiring another home care business, also in the developmentally and intellectually disabled space. That's 2 million of EBITDA, and we're buying it for just over 4 times.
Yeah.
So 2 exciting acquisitions we're working on that fit in the space, and all 3 will eventually be rolled into a Pillar Health group of companies. So
That's
excited
cool.
about that.
A couple questions. No, just first, I think I do want to go back to your first point about the difference home care, home health, and hospice. Like I know that was one of the very first questions I asked you. Like, what's the real difference? Can you just give us like the quick, what is the difference in those 3? And then I want to dig into some of the metrics here.
Yeah, and different people use the terms differently, but generally speaking, home care is usually used to refer to the part of the industry that is unskilled care. So that is going to be assistance with daily living. That's a very common term you'll hear in the industry, ADL. And what that is cooking, cleaning, laundry, meal prep,
Sure.
even transportation, unskilled services, non-clinical services. All right. Home health, generally speaking, is a form of healthcare in the home, right? It is clinical services in the home. So that is mostly broken up into either nursing or therapy. Those are the 2 biggest areas within home health. And when I say nursing, that's an RN or an LVN going into the home to provide actual clinical care to the patient, or it's a physical therapist, a speech therapist, an occupational therapist. There's several other types of therapy going into the home to provide clinical care to the patient. And then the last one is called hospice, and hospice is end of life care. It's the highest acuity of the 3, and it can be, hospice actually has a range of services depending on the condition of the patient, but it can be anywhere from, a nurse going in once a week all the way up to 24/7 care, right?
Sure.
So it's kind of a continuum of care, if you can imagine, between the 3, with home care being the least skilled or least clinical, and hospice being the highest acuity, right? So patients who are really about to pass away within 6 months is the standard. So that's the difference. Yeah.
And this is, I don't know, the question I want to ask, the macro question is, how should one think about sort of the pros and cons of acquiring a business in those three categories?
Sure.
Obviously, right, as you said, sort of the skill profile is increasing from home care as we go up to hospice. So I assume that probably means, obviously the dollars per client are going to be going up, client's the right word, but patient going up as well. Perhaps the margins are going up, but I would think it's a lot harder to recruit talent or retain talent. But that's just my gut reaction reading that. How do you think about pros and cons?
Yeah, that's a great point, Tony, and you're on the right track. So generally speaking, margins are going to go up with higher skill level there, right?
Mhm.
So home care, so I should tell you, the payers between the three are very different, right? So home care, Medicare, traditional Medicare doesn't really pay for home care, unskilled care in the home. Generally speaking, it's either a Medicaid supported program through a state, or it is commercial insurance, or it's private pay, right? And even commercial insurance isn't that common. So that's what the payers look like there. The margins are lower. The multiples on the businesses, like the M&A multiples, are lower in home care, generally speaking. And that industry is a little bit, I would say, a little bit more volatile.
What reason?
The level of, the types of folks you're hiring also are different, right? So you're really competing with, if you can imagine, other low skilled type jobs for those employees, right? So you're competing with, Walmart, fast food restaurants, things like that, right? For the skill level. Home health, most of your employees are going to be skilled employees, right? So you're really competing with like hospitals and other healthcare companies for nurses and therapists. The margins are generally speaking higher. The majority of revenues in home health are Medicare, traditional Medicare revenues, because traditional Medicare pays for those services. Commercial insurance is the next biggest one. Private pay is very small in the home health industry, but there is some private pay business. And the multiples are higher, right? And I'll go back through the three at the end, but
Sure.
Hospice, hands down the highest multiples, hands down the most technical, I guess you would call it. It's going to be the highest acuity, right? So patients with very serious conditions, up to passing away. You're going to be you're going to be hiring nurses again that are usually specialized hospice nurses. So a lot of times home health nurses don't want to do hospice. Hospice nurses don't want to do home health. So it's a specialized set even within nursing. The margins are very high. Almost 100% of hospice revenues are paid by Medicare. And it comes out of a separate fund than the general Medicare fund, but they are Medicare funds, right? So very little commercial insurance or private pay in hospice. And the multiples, like I said, I'll go back through the three. Hospice multiples can be extremely high. So unless you buy a small one, even 1 million EBITDA hospices can trade for 7-8 times. Home health companies, 1 million of EBITDA, you can find them for 4 to 6 times. That's pretty standard. Home care, I think you could depend, 1 million EBITDA home care company, I would say 3.5 to 4.5, maybe 5 times. So that's kind of the range there of valuation. Now, what I would say for a searcher, if you do not have a healthcare background, home care is going to be an easier place for you to get in initially.
Because of the licensing and the regulatory piece that we're going to touch on in a second, or more expertise?
Just expertise. So surprisingly, in most states, and don't quote me on this because I haven't researched every state, but most states, you don't have to have a healthcare background to own any one of these three. Now, you do have to have a licensed home care professional, a licensed healthcare professional for your home health business. You're going to have a director of nursing. You're going to have an administrator who has had significant healthcare administration training. On the hospice side, you're also going to have a director of nursing. You're going to have a medical director who is going to be an MD. You have to, but you don't, as an owner, have to have formal medical training. Yeah.
Got it. Yeah, I was under, and there's a question that came in about sort of licensing and regulation that's state by state. I was under the impression that as you sort of moved up the specialization or the expertise stack, that you would as an owner need to have a healthcare background, or that there was like to transfer the license from one owner to another was often difficult state by state. What am I misunderstanding in that? And are there specific states you would really like warn against and avoid, or others that are much more like M&A friendly?
Absolutely. Yeah, that's a great question, Tony. So, and you're dead right on those points. So I guess your first question there was the difficulty between, what was it M&A difficulty between states? So I'll tell you, there are certain states that are very difficult to buy home health companies in, for example. So New York, if you buy a home health license in New York, it's a crazy law, but it is what it is. There's a rule that you have to basically eliminate a license. So they have a moratorium on new home health licenses in New York, and also in addition to that, just on transferring licenses, even with a stock deal. So basically,
so you cannot transfer the license, you're saying?
Not without eliminating another license. It's a wild law. So you basically, if you want to buy a home health company in New York, you have to buy 2 licenses at once, and then you have to eliminate one of the 2 licenses. It's wild. And what you'll see then is if you like talk to the large, there's some very large home health brokerage firms out there. The New York home health companies are on the market for very low multiples, and people get really excited about them, right? And spend a lot of time, diligencing a home health company in New York, and then figure out after spending, a month of time on it, they run into this very difficult situation. So,
but is there not a roll-up opportunity? To your point, you could buy 2 of them at the same time and then roll them together into one entity that has the one license, right?
Yeah, that is an opportunity, but to actually get 2 of them lined up at the same time, that's difficult, right? You're not always going to have 2 companies at once that are,
Sure.
You can fold down one and roll it to the other, and the logistics of that is complicated. Generally speaking, for these types of 3 businesses, though, you do not need a healthcare license to do a transfer of ownership. Transfers of ownerships can be very difficult depending on what state you're in, though. So, for example, transferring a Medicaid home care business in Texas, pretty difficult. Texas Health and Human Services, not easy to deal with. Oklahoma, for example, transferring a Medicaid home care company in Oklahoma, very straightforward and easy process, similar to Arizona. It just depends on what state you're in. And that's because Medicaid programs are really by state. So, what you'll find is the Medicaid program in Texas, for example, is a ton different than the Medicaid program in California or any other state for that matter.
Sure.
But to your point about healthcare licenses, so most states have corporate practice of medicine laws. That applies to medical practices outside of this, generally speaking, where you're directly employing a physician. So, for example, most states you can't own a primary care physician practice, right? So you could not go out and go buy a radiology practice, for example, or an oncology practice. But you're not actually employing physicians really. In a hospice, you contract with a medical director, and that's about as close as you get. So those laws don't apply. Yeah.
Got it.
Yeah.
Well, and by the way, we're gonna transition this. I do this every time where it's like I find this just so fascinating. We start to like dig in on like literally slide 1. But just briefly again, all the points we were just making about licensing and transfer of licensing, or having to have a sort of medical background or lack thereof. Does that apply evenly across home care, home health, hospice, or is that like I would guess that home care, given that it is, there's not like nursing and whatnot, it's less skilled, that the medical licensing would be less onerous. I guess, yeah, I keep asking myself, to what degree is what you're saying apply to all 3 or just the latter 2?
Well, yeah, there's not a straight answer for that, unfortunately, because it depends on what state you're in for home care, because the laws are very different by state. And generally speaking, on the home care side, the contracting, for example, if you own a home care, and a lot of the home care companies in the country do a lot of Medicaid or VA contract work, and the contracting piece in terms of the transfer of ownership can be very complicated. Now, on the home health and hospice license transfer piece, if you're doing a stock deal, that's actually a relatively simple process. And that doesn't really have any tie to what your, professional background is. So none of the three really, in terms of licensing or contracting or for regulatory reasons, there's no concern around your professional background. However, home health and hospice are more skilled. So just from an experience base and you being successful as an operator, perspective, those are more challenging, certainly. Yeah.
Got it. Well, let's talk a little bit about and by the way, I apologize if anyone else is hearing this, but I'm getting some feedback. I don't know what it's coming from, but hopefully it's not too distracting. Can you talk a little bit? It's a first deal. We're almost 2 years, over a year and a half in. Revenue's up a healthy clip, which is great. And it's clear some wins here, but in like the broadest of brushstrokes, and we'll dig into some of these specifics later. You want to just give us like what are you happy about and not so happy about, and maybe things that would be like lessons learned that one could apply to their own search.
Absolutely, Tony. So we're very happy about our census growth. We talked about that a little bit earlier, right? So, we've grown our home health from 75 to 230. We've grown our hospice from 5 to 18, and we grew our home care, which is actually much slower moving than our other divisions. We grew that from about 280 to 310. So we're very happy with where our census has gone. We've launched some new specialty programs. So, a specialty program around, heart health. We launched a new specialty program around COPD, which is cardiopulmonary diseases. We launched a new specialty program around fall prevention and balance. And those have been really successful in helping getting our company's name out there and also providing a higher level of care to patients.
When you just unpack that point, when you launch a new specialty program, is the implication of that you're going to attract patients that you who wouldn't have necessarily worked with you before? And is that then who are you marketing that program to? Is it to these like states and the agencies, or is it to the actual individual families or somebody else?
Yeah, I'll give you a great example. So one of our, I guess, best built out specialty programs is palliative care, which palliative care, you can think of it on simplistic terms as a bridge between home health and hospice. So it's like home health patients, but home health patients that have, terminal illnesses, right? So they're going to be passing away in the not too far future, but they're not ready for hospice. So we started this specialty program. We put together a program booklet that really is educating families, and also keep in mind, while you're taking care of patients here, the families oftentimes are very involved in the decisions in terms of care and who to use as a provider. So we've got a booklet that educates, even clinicians need to be educated on some of this, because sometimes you're not dealing with a physician, sometimes you're dealing with a case manager or a discharge planner. So a really nice educational booklet. We had our nurse go through a special palliative care training program so that she's now palliative care certified. And in addition to that, we really had our whole management team do quite a bit of palliative care training. And we've designed our care for palliative care patients based on, guidelines that are provided by certain entities in the space. So we put all that together into a palliative care program. We talk about it on our website, and we go in to visit physicians. So, for example, we have marketing staff, right? And we call them, clinical liaisons or business development representatives. They go into physicians' offices, and they might go into, an oncologist office, cancer doctor, right? And talk to them a little bit about our palliative care program. A lot of companies in our space don't have palliative care programs. So that could be something that, a lot of oncologists, they have patients who really should be put on hospice services, but for whatever reason, either the patient or the patient's family is not ready to take the, that's kind of an emotional step, right?
Totally.
And
Yeah.
so
I mean,
if
you're
you can
basically,
have,
it's sort of the not a death knell, but it's sort of it's indicating that, oh, this is end of life versus maybe
yeah,
holding out that things are going to get better.
right. So having a palliative care program allows us to provide the care that that patient needs without putting them on quote unquote hospice care.
Yeah.
So that's something that oncologists, for example, really care about, right? Because they want a company that they're going to be working with that they know can treat their patients at home without, the patient's family and the patient having a real hesitation to take on the care. So that's something we talk to physicians about. It helps us recruit nurses because palliative care is a really kind of a hot thing in the industry right now. And nurses want to learn about palliative care, so it helps us recruit nurses and teach them how to provide palliative care. It helps us find patients because it's a unique offering, and it helps us build referral source relationships like with physicians and discharge planners and things like that. Does that make sense?
Yeah, it does. If there's a macro takeaway here, it's the biggest lever that you guys have been executing, it sounds like, is by introducing these programs. You are driving sort of specialization that's helping you attract other patients. You're using this channel through marketing to sort of doctors, so they're recommending to patients, but also through building out this like programming, you're attracting better and more nurses. Probably helps with retention because they feel like they're developing a specialized skill set and sort of checks all the boxes
It
that
does.
essentially are allowing you to grow the patient count, right?
It does, absolutely.
Cool.
Yeah, that's a great summary, Tony. Yeah.
And on the challenges side, because I do want to hop to more the general good versus great in a sec. Were these challenges unique to your situation in particular, or is this something that sort of crops up with the two that you're talking about here?
Well, the first one was unique, unfortunately. So we went through a change of ownership process. The state of Texas is really strange, and this is why it's so important to realize that home care regulations between states, especially if you're dealing with Medicaid funds, are so different, and there are many particular strange things between the states. So there's a code hidden in Texas Administrative Code that's separate from the change of ownership process that says basically you have to give them, you have to provide 2 months advance notice before a change of ownership to the contracting department in Health and Human Services. Well, we went through the normal change of ownership process. I mean, we contacted Health and Human Services and let them know that we were having a change in ownership. They actually sent us a letter telling us that they accepted our change in ownership, and this came from Health and Human Services. Well, 6 months later, we got a letter in the mail, and they let us know that we hadn't informed them correctly. And turns out we had let one department know, and that was the main department, but they did not communicate with the contracting department. And so, and that wasn't in the contract or anything. It's in Texas Administrative Code, a humongous code. And so, long story short, they sent us a letter and said, you're going to go on a vendor hold because you didn't inform us correctly. And well, we sent them the letter from Health and Human Services, their own department, and said, we did, and here's the letter approving our change of ownership. And they said, well, you didn't let this sub-department know separately.
Yeah,
so
classic bureaucracy right there.
It was horrible.
Sucks.
Yeah, so we got put on a vendor hold with Health and Human Services for 6 months. And we called them and explained, this was a simple, dotting an I thing. And there's no negotiating with them. And that's kind of what dealing with some of the local state governments is like. Some of their contracting departments are like that. So my recommendation to any searcher doing this is make sure you work with advisors who have done this before, specifically in the state that you're doing the acquisition in, and make sure you get the right advice. So you want to do a lot of homework on this and make sure you do your change of ownership correctly. The next challenge on there is a challenge I think that really just about anybody is facing right now, and it's very challenging to hire staff. So that's just, I think, across the board, with just about any business, but especially lower skilled businesses. And we, in our home care business, we do hire lower skilled individuals to help us on our team. And that's been a real challenge here lately. So, and it is a hindrance to growth, right? I mean, I can hire great marketers and build great specialty programs and build great relationships with referral sources. But if we don't have nurses that can be, on the spot when a patient gets released from the hospital or the clinic, we can't grow. So, and it looks bad on your reputation, right? It hurts your reputation when you do not have adequate staff. So that's a major challenge in this industry, and people should be aware of that.
I've heard this from everybody who operates in this space, that is the limiter on growth, right? Is to be able to recruit and retain these staff, which I definitely want to circle back on, because it feels like anybody who's acquiring a business and expecting to grow it, right? That you're going to be able to, you have to nail that. And so let's pick up maybe in 10, 15 minutes, what it is that you feel like you've learned as a means of best recruiting and retaining folks. We talked about the specialty programs as a means of doing that, for the nurses at least, but let's revisit that in a sec.
Absolutely.
So let's skip, I know we spent a lot of time on this. I think I want to just really gloss briefly on this area, but I think, this question of why do you buy a business, obviously people can read through the points as to why you did it, but the natural questions that I think this begs is, given everything we've talked about, this strikes me as a very intimidating industry to get into if you don't have this background already. And so I assume there's probably a lot of searchers on the webinar today that don't have a background in home care. They're thinking about this space for all the reasons you're listing here. What's the best way to get, how should one get up to speed on this industry? And do you have like a way to think about when should someone lean in and actually seek to buy this type of business, or when do you think they should lean out, given all the challenges we've talked about?
Well, I think it would be challenging for someone without any healthcare experience at all to buy, a hospice. Home health would probably be okay if you had the right advisors around you, and home care certainly would be okay. You really do not need a medical background at all for home care because it's unskilled services. The only thing that's unique about home care versus other industries is often you're billing insurance of some type, and that can be complicated. But for home care, the billing is so much simpler than other types of healthcare billing, just by leaps and bounds. So, the functions in a home care business, just so searchers know, I mean, you're paying payroll, you're billing, you're managing staff, and you're managing, patients, and you're managing records, right? There is some compliance to it. But generally speaking, it's somebody without a significant healthcare background can do the job. It is not healthcare. On home health, it's something you can learn pretty quickly. So if you had the right advisors, I think, like I said, a searcher could get up to speed pretty fast. I would probably steer most searchers away from hospice if you don't have healthcare. My business partner had a healthcare background, so that's kind of the reason why we were able to do that and be successful, I think. Yeah.
That makes a lot of sense. And can you touch on, I guess, this high variable cost structure and why it's ideal for life? Just briefly unpack that. And I do want to chat in a sec between the SBA leverage and the seller note. To what degree in this industry is like a larger, it was a question that came in, to what degree is a seller note or a larger seller note often a component?
So on variable cost structure, and by the way, I saw that you here recently interviewed Sam and Nicholas on light manufacturing and HVAC, and I just want to state for the record, they're not on the call, but I want to state for the record, this is a better industry than both of those. And they would, I know them both, so they would laugh if they heard me say that. But it is like I'm clearly biased, but objectively, I think it's better for searching, especially if you're using SBA financing and levering the business, because it is a highly, generally speaking, it's pretty highly recurring. the cost structure is about as variable as you can get.
The
I mean,
people, I
right?
would guess, right?
It is 100% payroll. I mean, not
Yeah.
100%, but it is almost all payroll, right? And it's generally speaking, depending on what your cost structure is, most of your employees are probably going to be paid per visit or pay per hour. So even the pay for your labor is variable, right? So it's not like you're even having to lay people off oftentimes. So variable cost structures are great when you're using leverage, right? Because you don't have a lot of fixed costs. And what that means is if revenue drops, most of your costs go away. So that allows you to continue to pay, your debt and have
Totally.
good debt coverage. So that to me was really important, knowing that I was going to be, using an SBA loan and personally guaranteeing the deal. I wanted something that, if things did go wrong, I would, not be in a real jam really fast, which
Sure.
a lot of other industries that folks go into aren't like that. So that's one reason I really love this space. Yeah.
And the lenders know this too. So I assume there's a great appetite for lenders to partner and offer, higher leverage in the deal. I assume you're pushing the 75, perhaps 80% leverage from just the SBA lender themselves. To what degree then did you seek out a seller note in deal one? And to what degree is that prevalent, you think, in the industry?
I don't think it's any more prevalent than any other industry, as far as I can tell. I can't say for sure because I haven't done formal research on that, but we've gotten seller notes on every deal we've done. On the first deal we did, our seller note was for 10%. On the deals we have under LOI, one is for 10%, the other is for just over 10%. So
Got it.
just from my own personal experience, I think around a 10% seller note is pretty standard. So I would encourage people to get a seller note if you can. And if you don't, though, it's not the end of the world. So if you got a great deal and you can't get a seller note on it, I mean, I would still do the deal. I would not let a seller note stop you from doing the deal. Yeah. Maybe you can get an escrow instead, right? I mean, that's a way that you can kind of mitigate that the risk from the seller side, right? So I like escrow. I like escrow a lot anyway because that's like cash right now. A seller note is really over time. So generally speaking, if you're going to run into a problem, it's probably going to be a cash flow related problem. So you're going to want cash now rather than a seller note, which would take years for you to realize the benefit of.
That's a great point. And I don't have much experience there personally. What's the typical fee or rate that you're paying up for escrow service?
Oh, I couldn't tell you, Tony. It's very small. I mean, it's like 1% or something like that. It's very, very low. Yeah. And you earn interest on your escrow funds. So while the escrow is in there, it earns interest. Yeah.
Interesting. So, but you can't utilize those funds once they're locked up in escrow.
No,
right?
They're locked up.
Yeah. Cool. I think we can probably, well, actually one more question on this slide. You mentioned the idea with PE and multiple expansion. Obviously this is a trend in lots of different industries, and clearly you're buying relatively low multiples, right? 3 to up to 5x. I'm asking a broad question. If you have some specifics you can share, great. Like at what level of EBITDA or revenue, or like what's the point at which the multiple expansion really starts to kick in from private equity, and what's the underlying reason for that, right? If I recall from Nicholas's HVAC conversation, I think what he said was once you get, there's like significantly like unlike in your business with high variable cost structure. In HVAC, a lot of the costs are tied to the actual equipment that you are installing, the actual HVAC systems, and that the cost of those units drop dramatically when your purchase volume increases from the manufacturer. And so as you roll up, you can actually drive much greater efficiency and higher EBITDA margins in a business. And that drives the PE multiple. What is it about this space that drives that multiple expansion?
Yeah, that's a good question. So I think, so that's interesting too, Tony. So, you would think in the scenario you just described that would drive EBITDA margin expansion, but not necessarily multiple expansion. In the scenario you just described.
Fair.
So
Yeah.
I can see where that was going, but in this space, similarly as you scale the business, while it is a variable cost structure, there are efficiencies, right? So you really only have to have maybe one local presence in a market. You also, there are back office costs that are scalable, right? So for example, one director of nursing, that's a pretty expensive employee. One administrator for an area, that's a pretty expensive employee.
Yep.
So there is that. In addition to that, I just think that the stability of larger agencies in this space is, there's a significant difference there. So home health companies go out of business a lot. There are a lot of smaller agencies that go out of business, and the larger ones with established reputations, and established, for example, like marketing staff. Many of the smaller businesses don't even have marketers. So when we bought our business, the business didn't have a single marketer. So the relationships, there were not many relationships, and some of those relationships left when the sellers left. So as you get bigger, for example, now we have a marketing staff of 6 people, right? And if myself and my business partner sold the business, there would still be relationships there between the marketing staff and the referral sources. That would be one example. But there's many reasons. The margins tend to be better with larger home health companies. But in addition to that, they're more stable. So if you think about like a strategic acquirer, right? So we got for example, we got an indication of interest from a strategic acquirer on our first deal earlier this year. So we bought the business for 3.7 times into 2019, and we received an indication of interest for 6 to 7 times in the first quarter of this year. So, I mean, already that's significant multiple expansion, right?
Sure.
But I think what they saw in our business was, clearly a much more stable business with a lot of potential growth upside, right? At this point, we have many specialty programs. We can take over 80 insurances. When we bought the business, we could only take Medicare. We've got contracts with some of the most lucrative payers like the VA, which are hard to get. And then we've got a marketing staff of 6 people and, a highly professional management team, which none of that existed before we bought the business. And acquirers look at that and, realize that, and also it's 3 services put together, right? So we have a full continuum of care. Most players in this space can't do home health, hospice, and home care. That's huge because if we get a patient, oftentimes we get patients with chronic conditions, we can serve them basically for their whole life.
Yeah,
right?
throughout their life cycle.
Yeah, which is big for, geriatric patients or patients who have a terminal illness. So those are all, significant competitive advantages we've built in this business. And, that demands a higher multiple. So
Sure.
There are a variety of reasons, but generally speaking, I mean, if you think about, for example, home health, million of EBITDA for home health, like I said, I'd say 3.5 to maybe 6 times. When you get up to 2 million, you're looking at probably, 5 to 7 times. 3 million, you're probably looking at, 7, 8 times. So there is significant multiple expansion. I just picked home health of the 3. They're similar multiple expansion between the 3, especially for hospice. But you see that, and strategic acquirers and PE are willing to pay those multiples. I'll say this also, for strategic acquirers, oftentimes they can take out back office staff, right? So think about that, right? The strategic acquirer we were talking to already had a location in the Dallas-Fort Worth area with an administrator and a director of nursing and other back office staff. They're not going to need to double that up, right? So if you think about it, if they're going to acquire us, instantly their margins are going to jump if they're able to utilize existing staff for to support a larger patient census. Does that make sense?
Yeah, it makes a ton of sense. I mean, I think what the takeaway for me from this is essentially as you transition the business that you acquire, from sort of the good to great, or like, I mean, you probably thought it was a great business to begin with, but you're doing these things to make it even better. It just becomes more stable. Obviously, in the margins are improving, but you could imagine someone thinks they could improve them even further due to the greater scale they're going to have, and as a result, that's a more valuable business across the board.
Yeah.
I think it's a good segue into our next slide here, because talking about, there's been a couple other questions, and I've held off on bringing them up about, how do you think about the mix of revenue? How do you think about, growth or competition? So yeah, I'd love to, like, why are these the metrics and how you assess in a business that you would acquire? And yeah, why don't we just walk through kind of how you think about the line between good and great?
Right. So the answers to these questions are very different, whether you're talking about home health, hospice, or home care, right?
Yeah.
So most of these questions I answered from the home health perspective, which is kind of in the middle of the two, but the answers are kind of different depending on which of the three you're talking about. Generally speaking, you want as much Medicare revenue as you can get, because it is going to be the highest margin, which is really weird. And when you tell someone from a healthcare background that you want Medicare revenue, they look at you strange, because in almost every other area of healthcare, Medicare is going to be the lowest profit payer. But in this space, it's the highest. So
why is that? What's the underlying reason?
Yeah, I mean, that's a good question. I think one reason for it is the government is trying to incentivize the use of home health services, just period, right? Because if you think about it, it costs the government, our reimbursement for a home health patient in a given month is, about $1,300, okay? So if you had that patient in a hospital bed for one day, it would cost Medicare more than $1,300, right? So this is a huge lever for the government to save money on healthcare, which is a major problem, right? The government, their healthcare needs are exceeding their budget, and they have, our healthcare costs as a country are going through the roof. So how do we reduce those costs? Well, 60% of Medicare revenues go to hospitals, right? So how can we get patients discharged from hospitals faster? They're thinking about that. Medicare.
Yeah, that makes a lot of sense. That makes a lot of sense.
Can we get them discharged into home health faster? Can we do more services in the home? And the place to save money is not on home health, right? You want to incentivize home health to be able to take those patients quicker, provide higher skilled care, right? And take more patients. And so I don't think that's an area they're trying to cut right now. The area where Medicare is trying to save revenue is on the big buckets, one of them being the hospital. So
I think you had shared with me before as well that the other natural benefit to at least the Medicare revenue is that because there is often a backlog of patients that need servicing, there aren't enough qualified providers, there's natural pricing pressure as well in Medicare. They're trying to attract more quality providers, and as a result, while not contractually built in, the average price increase is something like you said, 35%. It outpaces CPI in terms of the contractual per patient revenue growth. Did I understand that right from before?
Well, yeah, that depends. I think that's more true on the Medicaid home care side. So there are large backlogs of patients needing Medicaid provided home care services in several states. And because of that, you're seeing states talk about increasing their reimbursements for their budgets for home care significantly. And we've seen that in several states we've looked at. So that's a little different though than the Medicare side. I do not believe there is a significant I'm not aware of a significant national backlog of Medicare home health patients. On the Medicaid home care side, there are significant backlogs in certain states. And that is driving reimbursements higher, certainly. Yeah.
Sure.
Yeah. But so Medicare revenue, generally speaking, you want more Medicare revenue in home health. And like I talked about in the home care space, there's really not Medicare revenue, so that doesn't apply. On the hospice space, almost all revenue is Medicare anyway, so it doesn't really matter. Revenue CAGRs, I mean, so these businesses, generally speaking, are not tech companies, right? So they're not growing, at double-digit percentages. They're really kind of growing with reimbursements and with population growth. So, generally speaking, you're looking at revenue CAGRs in the single digits, which is fine because you're paying you're getting them for a good multiple, right? And you're in a very stable industry. So I'm comfortable with lower revenue CAGRs. And also I'll mention it's very competitive. So these industries, generally speaking, and it depends on what metropolitan area you're in, obviously, they are highly competitive, right? So it is hard to just go out there and grab patients because there are other providers out there trying to grab the same patients. So, having a high single digit revenue CAGR home health company target is good. And same with home care and hospice. Don't expect to be finding a 15% CAGR home care company. If you do, you're going to pay a very high multiple probably, but they're not very common. On the EBITDA margin side.
Before we go on
Yeah.
EBITDA, and again, I apologize for the background.
Yeah.
You touched on the competitive sort of nature of this industry and how there's a lot of providers. To what degree, how does that competitive landscape differ between the three, right? Home care, healthcare, home care, home health, and hospice.
Right.
And when you think about sort of the franchise operators, are they moving more strongly in one of those three or in certain regional areas that maybe should cause us to say, oh, we should avoid those areas?
Well, I would and I saw a question from somebody pop up. I just in general would steer away from the franchises, to be honest. And there's a few reasons for that, but that some of the franchises are very strict on, there's a lot of restrictions. For example, you can only offer certain services. You have to use certain marketing collateral. You have to operate in a certain way. You can't do acquisitions of competitors unless it's the same franchise. You aren't going to be able to go into new metropolitan areas easily. So I think buying a franchise home care business in some ways is kind of like buying a job, right? It really is going to limit your upside pretty strongly. So
you would avoid those for acquisition targets, but would you, to what degree would that, like a lot of those players in a given market be a detriment? Like how competitive would they be against if you were acquiring an independent?
Well, I can't acquire a franchise, period, because they will not allow me to. So it completely caps, for example, if you're a searcher that buys a franchise home care company, you're only going to be able to sell to another franchise home care within your franchise, which is going to totally cap your exit value, right? Because you're only going to be able to sell within the franchise and with their permission. And that's
right.
Pretty much the rule for all the franchises. Now, in terms of competition, I don't really think that, the franchise model, they're only going to allow certain competitors within a certain metropolitan area, but that doesn't really matter because you have so many independent competitors anyway, and other franchise competitors also. So it's just going to be competitive, period, whether you're in a franchise or not. If that's your question, Tony.
No, I think we're speaking past it a little bit. I think the question coming in and the one I'm trying to ask is I think the takeaway from what you just said is do not, even if you could, do not seek to acquire a franchise, right? So check. But I mean, like in terms of the competitive landscape, as someone who's largely ignorant to this space, maybe this question doesn't make a whole lot of sense, but I would think if there are a lot of independent or franchise competitors in a given region or market, like how should you be assessing the quality of that competition, and where should you be steered away from buying an independent where there is this type of competition from other independents or other franchise operators? And where would you say, oh no, there actually is an opportunity here? Like where would that not discourage you? Maybe is the question.
Yeah, I mean, so I wouldn't really, that's a good question. I don't know if I've evaluated enough to give an educated answer because I haven't been in a situation where I've evaluated, the local competition in terms of how many of them are franchise versus independent. I kind of just think of a competitor as a competitor,
Yeah.
I don't really see them as too differently. But the nice thing about home health and hospice is a lot of that data is available publicly. So for example, you can get on Medicare's home health compare website and actually see, you can look up like Medicare reimbursements for your competitors because it's publicly available data. So that's a really kind of a unique thing about this industry. And when we first got into this, we had a programmer actually put together, he went through Medicare's website, put together a full database for us of all of our competitors' Medicare revenues. And so we know exactly, how big our competitors are from a Medicaid perspective or Medicare perspective. Now you can, you can get online, you can look at market research, and you can also utilize some government websites to figure out how competitive a space is. Generally speaking, the larger metropolitan areas are going to be much more competitive than the rural areas.
Yep.
And across the three business lines, home health and hospice, well, home care is very competitive. Home health is very competitive also. Hospice in the past was not competitive. It is starting to get competitive because people figured out that it's very high margin and that the multiples are huge. So that is getting more and more competitive. Now, it also depends on the state you're in. For example, a lot of states have moratoriums on home health and hospice licenses. So, for example, you can't just open a new one in like Florida. There's some other states that are like New York, for example, which really limits your competition. So you have to think about what state you're in and also the metropolitan area you're in
Sure.
and the industry. So it's not a straight answer, sorry.
No, it's tough. We're also doing these three
easy
slices between care and health and hospice.
Yeah.
By the way, I looked down and we are fast approaching our 1 o'clock. Do you have we go 10 minutes over? Do you have flexibility or do you have a hard stop?
Yeah, I can go 10 minutes over. That works fine.
All right, let's do that. I think I appreciate it, Robert. Thank you. Let's I think the margin piece we touched on and sizing, I think, is probably obvious. The bigger, the more stable the business.
Yep.
Is there anything more? Yeah, I assume that's the case. Let's shift gears, I think, to diligence, because there's been also some questions coming in around, how to best, where areas to really dig into, especially given the more complicated technical nature of this industry. Can you just give us the quick overview on where to particularly pay attention to?
Yeah, well, in this industry, your due diligence is going to have to include a clinical diligence and a compliance related diligence and a billing diligence. Otherwise, you could open yourself up to massive liabilities. So generally speaking, if you're acquiring in this industry, you're probably doing a stock deal, because if you have any kind of contract or license, you want it to survive, right? And unless you do a stock deal, it's probably not going to survive. So, and getting licenses, contracts in place can take months, if not years. So you're probably going to do a stock deal. And if you buy a business, there's a lot of fraud in this industry. I'll just be right to the point. If you buy a business where fraud has happened in the past, that is still on your license. So, right, the government can come after you 5 years later for something the owner did, a year before you bought the business. So, you've got to be very careful about that. You want to make sure that the business is not violating anti-Stark law, anti-kickback law, things like that. There's a lot of opportunity for fraud in this industry. Billing is also
what is that, by the way? When you say fraud, what would be the specific type of fraud that is most prevalent, or how would you suss that out? I assume it's hiring some consultant to help you, but I'd love to unpack that more.
Yeah, I mean, one unfortunate thing about this industry is if you Google home health fraud, there will be article after article after article on Google. And there's actually, I learned this getting into this. I'm going to get to the point, Tony. But if you Google, there's also something kind of interesting. There's something called Medicare's Most Wanted. It's like the FBI's Most Wanted, but it's for people who committed Medicare fraud. Go on the there's actually a website for that. And many of the offenders oftentimes are home health people or hospice people, sometimes home care. So, and what it is oftentimes is people bill for services that they didn't provide. So, for example, in our industry, if you bill for wound care, you make a heck of a lot more than if you bill for just general services, right? Or if I can bill for continuous care for hospice and make a ton of money, but if I just bill for regular services, I don't make nearly that much. So there's ways to play with the billing and do it illegally so that you make a lot more money than you would if you billed correctly. So billing is something that's really important here, because if you, for example, if the company overbilled and Medicare catches it after you bought the business, you're going to have to pay. So you are going to have to come out of your pocket because it's your license, and your choice is you either pay the overbilling amount and the fees, or you get shut down. So that's something you want to do your adequate due diligence on. Hire the right people to help you do that, and don't do it yourself either. So another big instance of fraud there, or I guess it wouldn't be fraud, but it would be a violation of anti-kickback law, for example. Marketers will go into doctors' offices and tell the doctor that if you send me 10 patients a month, I'll pay you $1,000.
Yeah, I've heard you've heard these stories from the prescription like pharma companies at least a decade or two ago. It sounds like this is the case here too.
Yeah, unfortunately, it happens a lot, and that's another thing that can get you literally shut down. So you need to do your due diligence here because it's a real risk.
And is like Steckler Wayne that you got here, are they like folks you'd recommend to hire to do this type of diligence? It wasn't clear to me if they were a law firm or they were more of a diligence firm.
They're an M&A firm, so just really the mergers and acquisitions part of it. So you would want to hire, depending on what industry you're going in. There's some really good, clinical and billing diligence providers out there. One of the big national ones is called Fazzi, F-A-Z-Z-I. There's some other, really big ones that can be helpful, and there's some local ones too. If you're hiring, a Medicaid, if you're buying a Medicaid home care company in a state, like I told you, those are mostly going to be regulated and also contracting with the state itself. You're going to want to hire a local diligence provider. The resources here, though, Acevedo Edwards, that's specifically, for example, in Texas, and that's a law firm that would help you with clinical due diligence and also, Medicare, Medicaid legal issues. So that's one we use a lot. Yeah.
Well, maybe the big takeaway, since I guess in the interest of time, and just it sounds like there's the localization, specialization, and then there's depending on what flavor of home care or home health or hospice. How would one determine and vet a really good like diligence partner in this? That's a broad question, but how would you figure out who to work with?
Yeah, that's a good question. Well, so first of all, you want to make sure that they've previously helped clients in your state. You might ask to speak to references, previous clients they've had. You can ask them, just kind of basic questions about, what do you look for in an audit, and, get an idea if they've actually done the work. And sometimes you'll have diligence providers who do a lot of home health work and they don't do very much home care work. These are very different areas.
Yeah.
And you want to make sure that this person has previously done clinical diligence on a home care company in Texas, right? That took Medicaid revenues. Because if they haven't, those regulations and requirements are totally different than even a home health company in Texas. And way different than, a home health company in Arkansas, right? So, I mean, you really want a local person who has specifically done this type of business and these types of payers. So I would ask questions, ask for references. Yeah.
That makes a ton of sense.
Yeah.
Let's, I want to shift to this like biggest lessons learned, and maybe we can wrap here and then we'll go to takeaway on like if, I guess we've got the points obviously you listed here. We've touched on a lot of the stuff about fraud or the fact that this is such a complex and regulated industry. But anything in particular that you want to highlight or like big takeaways that we did or did not touch on earlier?
I think we kind of touched on most of these. Hire the right advisors. It's super important here for your clinical diligence, your change of ownership process, your billing diligence, making sure that no fraud is taking place. That's super important. And that really kind of ties in number 2 and 3 here. So, yeah,
okay.
That'd be the big takeaway for me. Yeah.
And going back to the top question, because again, in my mind, I think the biggest And I always like to add with this one thing they should take away. And clearly, I think we touched on a lot of this, but I go back to what's going to drive growth is what we used to talk about in the software world is like more butts and seats, right? Selling more licenses. In your world, it's, you know, increasing the census of these, like the patient counts you're working with. Are there a couple of one or two tactics that you think are particularly compelling as a means of either attracting the folks who are, if the bottleneck are the nurses or the home care providers that are going to be allowing you to take on more clients, what are tactics to actually recruit and retain those people? One or two that you found very effective.
Yeah, that's a good question. So I would say, number one, be willing to pay. Well, people might disagree with me on this, but we've used recruiters a lot, outside recruiters, and for the right clinician, be willing to pay up, right? So be willing to pay higher than their current employer. We directly, I'll say this unashamedly, but we directly recruit from our competitors because we really have to. And that's where the best employees are oftentimes.
Sure.
So be willing to directly hire from your competitor and pay a higher wage than them. Be willing to provide more flexible work hours than your competitors. Be willing to work with recruiters and pay recruiting fees. So we pay, for example, we hired a nurse, a couple of weeks ago. We paid a $7,000 recruiting fee for her. $7,000 recruiting fee. I mean, that is a lot for an RN, but it's actually not a lot because I have talked to other folks in this industry who have paid $15,000 for an RN. So if you find the right person, be willing to pay, whether it's a recruiting fee or a higher salary or a signing bonus, be willing to do that. If you can get folks under non-compete agreements, try to do that because that gets you in a much safer place as a company. I would say, one big thing for us that allows us to recruit better than national competitors. There are some national competitors in this space. Me as the owner, I am directly reaching out to many of these potential hires. And when they get to talk directly with the owner, that's a big deal to them, right? They want to talk to an owner. They don't want to talk to a recruiter for a national company oftentimes. And they know exactly the person who makes the final decisions, right? So, many of the employees we've hired over the last year and a half are folks that I initiated the conversations with. And, to this day, we have a relationship, right? If they don't like the way something's going in the business, I get a call on my cell phone, and they like the ability to do that. Where if they went to go work for some national chain, if you think about it, it's kind of like as a restaurant worker, some restaurant workers would rather work for a local family-owned restaurant where they know the owner of the restaurant versus work for McDonald's where you may not like your manager, but can you talk to the owner? I guess you could talk to the owner of McDonald's because it's a franchise. But anyway, you get my point. With larger national chains, oftentimes you can't talk directly to ownership. And I think that is actually a pretty big deal with our employees. Yeah.
Yeah, no, I like both of those points a lot. I think to a degree, again, my major takeaway for a lot of these industries in which we're looking to acquire businesses is like the people ultimately are the bottleneck. Often the technicians, the nurses,
Absolutely.
whomever, they're the bottleneck to growth. And so anything you can do to stand out in that search, in the acquisition process of those people, I think, and retain them feels like a winning strategy. I haven't heard a lot of people using recruiters, so I like that plug as well.
Yeah, it's been successful for us.
Cool. Well, I know we're over, and again, Robert, I appreciate you staying over and really just like dumping out your knowledge. People have sent in questions. We didn't get to all of them. And so if folks do want to connect, what's the best way to get in touch?
Yeah, send me an email or call me. And one thing I'll say is, I'm working with a searcher right now to acquire a 2 million EBITDA home care business in the Midwest. And, he's likely going to be able to keep, 70% of the common equity. It's going to be a huge life-changing deal for him. So if you want to buy a home health, hospice, or home care business, shoot me an email. Would love to help you do it. And, I'm going to be partners with that searcher. So our group would I think be a great partner for you in acquiring a home care business or a hospice business. We have the healthcare background, and we also have, we've gone through some, we've got the bumps and bruises from buying 3 agencies. So yeah, please don't hesitate to reach out.
Cool. Thanks, Robert. And for folks who I think been on some of these webinars or know me, like Robert and I have invested together. We're actually investing in one of the deals he mentioned as well. And so I think highly of Robert clearly. And as to reiterate earlier, like we are actively investing in deals like this. And so would love to chat. If you're interested in the webinars, obviously, you can shoot an email to webinars@Blue Maple. Otherwise, my email is just tony@bluemaple.co as well. But Robert, thank you again for your time. Thanks again to everyone joining and listening. I know we went a little long, and have a good rest of the week. Thanks, everybody.
Thanks, Tony. Really appreciate it.
Yeah, take care.